What is a late sign of shock in children? Hypotension. In children with heart defects, what classic signs would you observe? Poor nutritional intake, weight loss, lethargy, and fatigue. What arrhythmia is common in fetuses, neonates, and infants? Premature atrial contractions. What position in bed should a child or adult be after cardiac catheterization? Flat in bed. What is the most important circulatory assessment after cardiac catheterization? Pedal pulses. What are the signs and symptoms of cardiac tamponade? Muffled heart sounds, hypotension, narrowing pulse pressure. How long should immunization be delayed for a child after cardiac surgery? 6 to 8 weeks. What is the classic sign of digoxin toxicity in children? Nausea and vomiting. At what age does the anterior fontanelle closure occur? 18 to 24 months. At what age does the posterior fontanelle closure occur? 2 to 3 months. What is a ventricular septal defect? A hole on the wall between the ventricles. What are the classic signs of ventricular septal defect? Clubbing of fingers, cyanotic nail beds. What is the best intervention when a child with tetralogy of Fallot becomes cyanotic? Knee-chest position. What is coarctation of the aorta? A narrowing of the aortic wall. What classic sign suggests coarctation of the aorta? Pulses and blood pressure are greater in the upper extremities as compared to the lower extremities. How do we assess for hypertension in a child with a heart problem? Blood pressure reading on 4 extremities. After surgical repair for coarctation of the aorta, how should the blood pressure be managed? Maintain low blood pressure to preserve suture lines. What is the classic sign of a child with tetralogy of Fallot? Cyanosis with crying, activity, or bowel movement. What causes clubbing of the fingers and toes? Chronic hypoxia. In a child with tetralogy of Fallot, what test would show direction and amount of shunting? Cardiac catheterization. What is tricuspid atresia? Failure of tricuspid valves to develop. Therefore, there's no blood flow from right atrium to right ventricle. What is the classic sign found in a child with tricuspid atresia? Cyanosis. In a child with tricuspid atresia, what ABG result would be expected? Acidosis. What is total anomalous pulmonary venous return? Pulmonary veins do not return blood to the left atrium.